Hey everyone, and welcome back to the Three Koi Fishes channel. We are a team of experienced moms and dads with over 80 years of combined parenting experience. Our mission is to cut through the noise and provide clear, practical advice to help you navigate your parenting journey with confidence. Today, we are covering the topic, is my baby sick? There's almost nothing that sparks more panic in a new parent than that first cough, that sudden fever, or an unexpected rash. We've all been there, frantically Googling, is my baby sick, at 3 a.m., feeling completely overwhelmed and not sure if we're overreacting or missing something serious. Today, I am tackling that very real fear head-on. I'm going to be your comprehensive guide to common baby illnesses. I'll demystify fevers, break down rashes, help you identify the difference between a sniffle and something more, and most importantly, give you a clear understanding of when to act and when to call your doctor. By the end of this video, you'll feel more confident, calmer, and better equipped to handle those inevitable sick days. Let's begin the main video. Let's start with arguably the most panic-inducing symptom for new parents: fever. For newborns under 3 months, any fever of 100.4 degrees Fahrenheit, 38 degrees C or higher is an emergency. You need to call your doctor immediately or go to the ER. A critical point to remember is that the rules are different for tiny babies. For older infants, 3 months to 6 months, a fever warrants a call to the doctor to discuss next steps. For babies over 6 months, a low-grade fever might be managed at home, but always consult your pediatrician for guidance. The American Academy of Pediatrics, AAP, strongly advises rectal temperatures for accuracy in infants. So how do you take a baby's temperature accurately? My pediatrician recommended a digital rectal thermometer. It's the most accurate for babies. You just lubricate the tip with petroleum jelly, gently insert it about 1/2 inch, and wait for the beep. It's not fun, but it gives you the most reliable reading. And remember, a fever itself isn't a disease. It's a symptom that the body is fighting something off. Look at your baby, not just the number. Are they still playful? Hydrated? Or are they lethargic and inconsolable? That contextual information is vital. So, the key takeaway, under 3 months, any fever is a medical emergency. Always consult your pediatrician. Next up, the common cold. It feels like babies get them constantly. Most colds in babies are caused by viruses and just need to run their course. Symptoms include runny nose, congestion, sneezing, and a mild cough. Things you can do at home are saline drops and a nasal aspirator to clear their stuffy nose. This is a lifesaver, especially before feeding and sleep. A humidifier in their room can also help. And what about coughs? When is a cough just a cough, and when is it concerning? A wet, rattling cough sometimes comes with a cold. But my doctor said to watch for any wheezing, rapid breathing, or if they're struggling to breathe. Those are red flags. Also, a persistent, barking cough could be croup, which needs medical attention. The Centers for Disease Control and Prevention, CDC, provides clear guidelines on respiratory symptoms in infants. Always look for changes in breathing, like very fast breathing, flaring nostrils, or chest retractions, when the skin pulls in between their ribs with each breath. These are signs to call your doctor immediately. So, for colds, saline, suction, humidifier. And always monitor their breathing very closely. Rashes are another common culprit for parental panic. Your baby's skin is so sensitive. Some common rashes new parents might see include diaper rash, which is red, irritated skin in the diaper area. My best tips: frequent diaper changes, letting their bottom air out, and a good zinc oxide cream. Then there's baby acne, tiny red bumps that look like pimples, usually on the face. It's hormonal and usually goes away on its own. My own baby actually had cradle cap, which is scaly patches on their scalp. My pediatrician said to gently massage baby oil or petroleum jelly into it, let it sit, then gently brush it with a soft brush before shampooing. It's harmless, but looks a bit strange. What about when a rash is more than just a common irritation? When should parents be concerned? You should call the doctor for any rash that's accompanied by a fever if it looks like blisters, if it spreads rapidly, or if it doesn't blanch, meaning it doesn't fade when you press on it. A rash that doesn't blanch could indicate a more serious infection. Also, if your baby seems generally unwell with a rash, like lethargic or refusing to feed, that's always a reason to call. The Mayo Clinic has excellent visual guides on common baby rashes and when to seek medical care. So, for rashes, keep it clean and dry, use appropriate creams, and watch for any concerning signs or if your baby seems unwell. We've talked about common issues, but let's be super clear about the absolute red flags where you need to call your pediatrician immediately, or even go to the emergency room. This list is crucial. 1. Fever in a baby under 3 months. 100.4 degrees Fahrenheit, 38 degrees C, or higher. No exceptions. 2. Difficulty breathing. This includes very fast breathing, wheezing, grunting noises with each breath, flaring nostrils, or chest retractions. 3. Severe lethargy or unresponsiveness. If your baby is unusually sleepy, hard to wake up, or just not acting like themselves. 4. Poor feeding or dehydration. Fewer wet diapers than usual, dry mouth, no tears when crying, or a sunken soft spot on their head. 5. Constant, inconsolable crying, especially if it's high-pitched or lasts for hours. 6. Any rash that doesn't blanch, fade when pressed, or a rash with a fever. 7. Vomiting or diarrhea, especially if severe or persistent, and if there's blood in their stool or vomit. 8. Any signs of severe pain or discomfort that you can't relieve. And last, 9. Newborn jaundice that worsens, if their skin or eyes look more yellow. It's important to trust your gut. If something just feels off, call your doctor. You know your baby best. Your pediatrician is your partner in your child's health. Never feel like you're bothering them. This list isn't to scare you, but to empower you. Knowing these red flags can truly make a difference. I hope this guide has given you more confidence to navigate those inevitable sick days with your baby. It's a challenging part of parenthood, but with the right knowledge, you can feel much more prepared. Remember, your pediatrician is your best resource. Don't hesitate to call them with any concerns. And take a deep breath. You're doing a great job. If this video helped ease some of your worries, please give it a big thumbs up and share it with a fellow new parent who needs this peace of mind. And if you're looking for more essential parenting advice, consider subscribing to our channel to help promote it. Hit that notification bell so you don't miss our next video. See you next time.